So, good morning, everybody, and thank you to everyone doing the right stuff out there, and thank you to everyone who's been out since day one. We just entered now, believe it or not, 21 weeks. We just completed 20 weeks. It's been 142 days, and it feels like it was yesterday. If you ask me what I did 3 days ago versus 3 months ago, it all seems like it's one big day. So it's the first time in my life I can honestly say I can't remember what I did yesterday versus 3 months ago because it's, everything going on and decisions we have to make to go forward. But as of today, we have 2,282 positive cases of the COVID-19 in Albany County, 755 people under mandatory quarantine. So we have an increase of 13 positive cases since yesterday. So as I kept saying before, I thought we hit the apex. One little step back can set us back. One little ripple in the pond sends us in a different direction, or the domino effect. So out of those, one reported traveler out of state, so someone going to a state they shouldn't have. 5 had close contacts to positive cases. 5 didn't have a clear source of infection, so we're still tracing and mapping that. 2 positive people have been linked to the Hudson Avenue party group. That brings that total up to 46 people now, which I said this and I'll say it again. I commend them kids. They're coming forward. They're getting tested and they're letting us know what's going on. So it helps us stop the spread. It helps us understand what one little function or one little setback can have on the community as a whole. But I do, again, applaud you, Albany, in the city of Albany, Mayor Sheehan, and everyone for doing the right thing, and Chief Hawkins to come together and really support the community and let them know to do the right stuff. We have 64 active cases. 2 days ago we had 84, so we're down 20, so which is good. You're going in the right direction there. 7,156 people have completed quarantine. 2,218 tested positive for the virus. 21 have recovered out of that number, which is good. There are now 2 people in the hospital. That's down 1 from the other day. Hospitalization rate is at 0.08% of those who have tested positive. Yesterday, the rate was the same, so still going there. No one currently in the ICU, which is good. As of yesterday too, so that's good that no one's in the ICU. Over the last 5 days, there's been an average of 12 new positive cases each day, Yesterday it was 11.8, so we slightly went up a little bit there. I continue to tell everyone, I encourage you to get tested. I encourage you to go out there, especially that age group of kids, 20 to 29-year-olds. Please go out and get tested. I know you don't have any signs or symptoms. You're the ones that are keeping it out there. That's the group that continues to grow, not just here in Albany County, and I identified that months ago, but it's the same fact across the state, across the nation, and you're seeing like in Florida and Georgia. That's a group of kids that's really hitting harder, and it kind of morphed into something else more there than here, thank God. I'm glad you're not getting sick. I'm glad that you're not feeling any symptoms. I'm glad that you don't have fevers. I'm glad you're not hospitalized, but you need to do the right thing for the older population. As we said, we had 2 more people pass away 2 days ago and brought us up to 126 residents of this county that fell to this virus. So please do the right thing, continue to do the right thing, get tested. At the University of Albany, the number as always is 188-364-3065. Our mobile testing sites, to the people in the community, we keep talking about maybe pulling back on that, but that's going to help us in your community for underlying health issues, because this was going on way before in certain communities that have been underserved. And the way we can identify this going forward is with your help. So it doesn't cost you anything. If you don't have health insurance, even you, Albany, is not even asking for insurance. So, that, which is good. The state's obviously paying for that whole cost. We will pay for your test. Don't worry about the financial impact. And it takes literally 5 seconds. After you fill out the stuff online, you show up, you got your appointment, and you're out within probably 5-10 minutes. And it will help us going into the future, looking at resources going into these communities, how we deal with things. Because when this is over with, and eventually it will end, I hope, but when it ends, it will give us a clearer picture of how we can go into these communities and change the outcome for the people in these communities. So please do that. The Rite Aid in Colony, as always, go to riteaid.com. It's pretty easy. You can go online and get tested there. Priority 1 in Gilliland for the antibody testing, as always, our good partner there, 518-867-8040. Like I keep telling everyone, 4 things just to remember. Wear your mask properly. I know that's tough. I've said this and I'll say it again. Even after 20 weeks, I still forget to grab my mask when I leave my office when I come down here, or if you're getting out of your car to put it on. It's not habit forming. And you think after all this time it would be. It will take time. We'll get there. To the kids, I get it. It's harder for them, because they're running around and doing different things. But we'll get there by coughing into your arm, cleaning your hands, and staying 6 feet apart, and doing your part. It works. If one person has a mask on and other people don't, the only thing that mask is doing is stopping you from giving people it. It doesn't mean you can't get it. So keep that in mind, and like I said, we don't need confrontation. There's people that just aren't going to do the right thing. They don't care. They don't care, and they really don't care about themselves. So all I can say to the people out there, you can say to someone, hey, put your mask on your nose. If they're giving you an attitude or looking at you funny, just walk away. It's not worth it. It's not worth the fight. I say to people that don't want to go into shops and wear masks, I watched a guy put a cloth on his face to order something. I'm like, that defeats the purpose, man. That defeats the purpose. I get it. Order online. Get your groceries online. Order your stuff online. You don't have to go into these stores. You don't have to go into these establishments. They'll deliver to you. But protect the workers that are in there. The workers deserve to go home safely to their families, and they can't if you come in. And the last thing a worker wants to do is argue with you. And the good thing having the two great, awesome superintendents I have with me on the left and right is that, they're going to be talking about our school kids going out and going back to school and what that's going to look like. But again, we can do this working together as one. So some of the things I want to talk about before I turn it over to the superintendents, because I know that's why everyone's here. We've been having conference calls on the budget. So what's that mean? We're waiting for stimulus package 5. So there's 3 bills that's been pushed forward. Congress is pushing the HEROES Act, which we're in favor of because that brings $3 trillion into all the states, spread out, and it'll bring $1 trillion to local governments and states and stuff like that, which will help us. And it's going to help the school districts. It's going to help government. It's going to not just the state, not just the county, city, towns, and villages, because we all are going to be in trouble going forward. The HEALS Act, which the Republicans are pushing, gives us no bailout, gives us no money, doesn't help. And the same thing with the skinny relief, which they have in there too. So what's alarming about that is that I've said this and I'll say it again. I don't care if you're Republican. I really don't care if you're Democrat. I don't care if you're conservative, liberal, working families, whatever party you belong to. We're in this together, and the only way we're going to get out of this is together. And to be playing politics on this level in D.C. right now, I think that's what the people are tired of. We need our federal government more now than ever, from our president to Congress to Senate, to put the bipartisan aside and make this happen. What scares me, being president of County Executives of America and talking to other county executives across this great country and talking to other governors, is how this is really going to affect us moving forward. And, I'll say this, right? You're a politician, you got to be able to play politics, right? So I'm going to be as clear as I can on this. I have a feeling what the Republicans are going to do is come back in September, because if they don't pass this week, they're done. They take a break now, and you won't see anything until after Labor Day. They come in at the end, mid-September, play politics for a presidential election in November. And what I'll say to them is, it's not time for politics. It's not time to point the finger. It's not time to sit there and play with people's lives, because now the $600 is gone, and other ripple effects are going to happen, which people aren't talking about. Our hotel occupancy rate's down. People aren't shopping. Even though grocery stores are open, they're not making the money they made a year ago. The local stores are down 60 to 70%. This all has a ripple effect, and if you look at what happened in 08, 09, when we hit that little recession, the difference between us and the rest of the state of New York, we're kind of insulated, because we have the state of New York right here. We have a lot of state workers, government workers, so we didn't feel it as much as other counties that are still kind of didn't fully bounce back from 08, 09. If we don't get this bailout, I don't think people realize, and I'm not trying to scare you, the governor's going to have to lay people off. The governor's going to have to cut the budget, raise taxes, cut the budget. We're going to be doing the same thing. We're going to have to do the same thing in the county. School districts are making tough decisions on top of what they've been doing, and I feel for them, because they have to educate our kids. They got to build the foundation for our future. And on top of what has happened in the world rechanging and reimagined to where we're at, they had to feed kids. They had to figure out how to do online learning, get learning to kids, and I'll let them talk about all that. But tough, But these are harder decisions as we go forward. When people want their sports, they want their music, which music and arts is a foundation of our culture, and you need music and arts more now than ever before. But when you got to make tough decisions in our jobs, and we do every day, it's like, you think they want to cut arts out. You think you want to cut music out. You think I want to cut different programs out. No, but you got to pay the bills. And you can't pay the bills when the money's not coming in. So I will encourage everyone out there, all the viewers, please, or anyone listening to this, reach out to the Senate, reach out to Congress. Congress has been great. I want to say this, Senator Schumer has been a champion for New York State, and not just for New York State, for this nation. Senator Schumer and Senator Gillibrand, but Senator Schumer's in the minority leader's position, has doing, I can't begin to tell you. He was on our conference call the other night. He talked to us about it. You could hear the frustration in his voice. He knows what's on stake here. He knows what's ahead of us in this country of ours. Again, this is a fact as we start to reopen it up, and we still have a health crisis going on. We have an economic crisis going on, and as we continue down this road, the next couple of months, it's only going to get worse. Again, we lost, I think, what we say, $15.6 million in revenue, and that's just sales tax. That's not including everything else that comes in: bed tax, filing at the clerk's office, buying food in general. That's just that one little sales tax revenue. So third quarter could be worse. It's probably going to be, and then every programs are going to be cut by 20% across the board on a lot of stuff. So please reach out to the Republican Senate. If you got friends, don't have friends, write them letters, call them, tell them to support the HEROES Act or support something that gives local governments some relief from what's going on. So that all being said, I do want to say it's great to watch these two great superintendents, Superintendent Adams and Superintendent Perry, and I got to know you when you came from Vegas. I'm like, why would you move from Vegas to here? Nothing against, I love this area, I love representing it, but I'm like, man, Vegas is pretty good, got a lot going on. But her record speaks for herself, coming from Nevada and then coming here and changing the climate. And really, they build a foundation. I can sit here all day and say we run all these services, but you have the future of our next politicians, our next presidents, our next doctors, lawyers, wherever they want to be. But you build the foundation in your school. So I do want to thank the two of you for what you do day in, day out. I know you represent 10,000 students, my daughter being one of them. So my daughter goes to Albany High, and great experience she's having there. But I want to turn it over to you first, let you go, and then I'll turn it over to Dr. Perry.
Thank you. Thank you so very much, County Executive McCoy. It is such a pleasure to be here today to talk about what we're getting ready to look forward to as we look to open schools in whatever form or format that we need to do that in. First of all, districts across the state were charged with developing reopening plans. And these reopening plans needed to address three different models: in-person, a hybrid model, as well as a virtual learning model. So here in the City School District of Albany, one of the things that we did, we started to reach out to our employees and develop a committee so that we would have representation of all of the internal stakeholders to help us develop a framework. What are some of the things that logistically we would need to work through? And then from there, we started to engage our community, and we had parent forums, student forums, and we also held a forum for our faculty and staff so that we could get more input. And so one of the things that we've looked at, and these committees were extensive in looking at the safety and well-being, that was first and foremost. What are those guidelines that came from the governor's office that we needed to follow, that came from Department of Health, so that we could make sure that we had that infrastructure in place to bring people back in a safe environment. We are currently doing health screenings. We have our ESY program in place, and we are looking at what every day we screen employees as well as the students, and that is something that will be required as we move forward. We're also looking at what are those components with regard to transportation and maintenance and operations, the cleaning and the sanitization of our buildings on a daily basis. And so those guidelines we have to follow, and we have put the structure in place for that. Instructionally, in looking at what would it be if we were to bring students back in person, we're looking at pre-K through 5 going to school 5 days a week. Now, that means that we may have to use additional buildings, so that impacts middle school and high school. And so with looking at the numbers of students that we have, we would not be able to house all 10,000 of our students each and every day and maintain social distancing. So what that means is at the middle school level and the high school level, we would have to look at some hybrid model where they are rotating on campus 2 to 3 days a week, and 2 to 3 days a week they may be off with an advisory period or a hands-on day where they're getting the music and art. And for example, some of those science labs and things like that would be on 1 day a week. Those plans are still being discussed because, again, we have to work through some of those details. At the high school level, we would be able to look at a rotating schedule, which would be a blended model as well. And then one of the things that we're looking to do based on some of the surveys that we've sent out to our parents and to our faculty and staff is offering a virtual component for those families that still may want to have that virtual experience because they're kind of unsure about having their students in school each and every day or on a rotating basis. And so once we collect all of that data, we'll be able to look at the staffing impact, the facility impact, and then determine what would be the best way in moving forward. But right now, our plan does include in-person models. It includes a hybrid model as well as a virtual model. And so all 3 of those plans we have worked through to some degree so that when we know exactly how we're moving forward, we'll be ready to delve down into the details with regard to that.
Thank you. And as everyone should be aware of, today is the deadline for the school districts to submit to the state for approval of whether or not they're going to get the green light to open up. Part of the HEROES Act, too, and I should have brought up, is addressing daycare for children, because a lot of workers, now that in Albany County, we don't have 100% of the workforce back. So what's going to happen, though, as we start to bring more and more people back into the workplace, socially distancing, is parents and teachers will need daycare. And if daycares aren't up and running, well, what do you do with your children all day? So that's another thing we're dealing with. But Dr. Perry, who represents the Colony South District, correct?
Correct.
5,000 students. And what's it going to look like for you when you start to reopen up in the fall?
Well, thank you very much, County Executive McCoy, for inviting me here today, and for Dr. Adams to be here as my colleague. We've been working collaboratively with our reopening task force. It's a constituent group of parents, teachers, faculty and staff, our O&M staff, our community partnerships with our county police, EMS, and fire department, as well as our Board of Education members. This task force is not working in isolation. They're working in partnership with many of the area school districts in the community. Our Capital Region BOCES has led the charge in uniting our 24 school districts, and I'm very appreciative of the efforts of all of my colleagues in the area, including Dr. Adams. It's been a monumental task, but also one that we feel is manageable and achievable. Our plan for our students is very similar to the City School District of Albany, in that it will involve both in-person, a hybrid model, and an option for parents to keep their students home on a 100% virtual option. With our primary focus being on the health and safety and wellness of all of our students, faculty, and staff, our community members as our guiding principle, to maximize the educational opportunities. And in order to do that, we are focusing on a model that prioritizes pre-kindergarten through 6th grade in person every day. We are looking at prioritizing our self-contained special education students from pre-K through 12th grade in person every day. In 7th through 12th grade, we are looking at a hybrid model. Not all hybrid models will be identical, but ours will be looking at a 3-day rotation, a ABC type of rotation, where a day a student is in person, 1/3 of the class is in person, The other 2/3 of the class will be home virtually, working with the teacher, perhaps in a Google Classroom setting, a live stream setting. And then on that rotation, the second day, a different group of students will be in, and the third day, the final third group of students will be in. That rotation will allow us to change from an in-person hybrid model to a potential all in-person if we get the okay to bring everyone back at some point in time throughout the school year. It'll also allow us to go 100% remote if necessary, and those are certainly parts of the plans that we're looking at. The other driving factors for us is to assist with controlling the spread of the virus, which I know in Albany County you just stressed wearing the masks will be a requirement for all our students and faculty. We have a self-check model that is an electronic app for our faculty and staff. We've been working through that this summer with our extended school year program. So far things have worked very well. We are maintaining social distancing, so we're currently going through all of our classrooms, removing excess furniture, redesigning what a new classroom will look like for the fall, and trying to provide as much autonomy in the classroom educationally for our teachers as possible. We will be working with our unions to identify concerns from their members so that we can address those concerns before the opening of the school year. We had a series of live stream sessions for elementary, middle, and high school parents for our faculty and staff, very similar to many of my colleagues. We gained vital information related to feedback and concerns that the families had. The common concerns are certainly for options, and we will be presenting options. All options may not be identical. Certainly delivering in-person instruction is different from a virtual instruction. But we will be messaging out to our families once the governor makes a decision on whether schools can reopen sometime between August 1st and 7th. We will then send out a survey to our families asking them for whether or not they want to return in person or if they will opt out and go to a virtual environment. There are some parameters with that. If they opt out of the in-person or hybrid models, they are also opting out of other things like co-curriculars and potential for interscholastic sports in the event that we have approval to run those programs. Currently, athletics are on pause until at the earliest September 21st, so that's still a waiting game at this point in time. Similar to what Dr. Adams had mentioned, many of the specific details are going to be continued to be vetted out over the coming month. We will continue to work with our teachers and faculty to identify what it looks like at each level as we move forward. But our plan is currently live on our website. We would encourage community members to review the plan, to continue to ask questions, and we will go forward with those three options.
Thank you. And that's probably just a little bit of the details they're getting into. I know their plans will be on their websites and their school districts, so you can look at the website and get some of the idea of what they reimagined opening up. And I do want to compliment the two of you because you have to deal with the school board, you have to deal with parents, and all the requirements from the state and fed. So it makes their jobs challenging. I say to parents, you got to be part of the solution, not part of the problem. You can, think of the teachers that have to come back and be in a classroom all day with a mask on, the janitors, the people working in the kitchens, the security. I mean, I could just go on and on. The administrators, the principals, vice principals, they need your help. And the only way you're going to be able to do this and make it work is working together and rolling up your sleeves. And you have a population of kids that have been underserved and need guidance and they need help right now. And they're already behind, and now they're going to fall even more behind. And if we don't figure this out going into the future, if we have to shut down again or if schools can't stay open, we have to make this work. We have to get it right because we owe it to the kids, and I'm glad the two of you brought up the point about kids with special needs that need to be in the classroom, that need structure, that have a routine every day that's been so far off and they can't handle it, why things have changed and they can't do the things they used to do. When it took them a long time with therapists and everyone else to get them to where they're at now, it's a huge step back. So please, to the parents, try to understand. I know there's a lot of emotions going on. I know there's a lot of arguments going on. Be part of the solution, not part of the problem. Don't be that Monday morning quarterback. I was just saying this earlier, and I say it at least once a week. Please, by all means, if you have a better way of doing it, let them know. Trust me, we're not perfect. We're going to make mistakes. We're going to try our best. We're going to try different solutions. Just do the right thing. A good book for you parents, I think it was, that was a Thomas Sowell, Inside Education. Please read that book. Kind of opens up your eyes a little bit. Our teachers are the ones on the front line inspiring your children and educate them for the future. So please, again, help them do that job. So again, to the two superintendents, thank you. I know you're going to take questions. They're not going to let you guys, ladies, run out of here that quick. But on a different note, I want to just talk about a little bit about the food vendors on the rail trail. They've started, so you may see them on our Albany County rail trail. They're out and about. So right now there's kettle corn at the Singerlands Trailhead and another food truck at the Albany Trailhead just in time for National Sandwich Month. I went there yesterday. There was a house that was on the bulk of our rail trail by the Singerlands Firehouse. We took it down, and we're going to be redeveloping that whole area and the bridge eventually to enhance the rail trail. So stay tuned for that. But again, things get difficult with the economy shutting down and the coronavirus and local businesses. So we're just trying to help these vendors get out there and service the community that's walking. We've had over 200,000 people last year on our rail trail, and it has grown. I was there. There's been a lot of complaints about people riding bikes. Yeah, I'll say to the people on the bikes, you have the right, but yeah, you were going quick. When I was standing there, they were whipping down that road, and it is scary for somebody to walk in, or you have small kids, because you're on the rail trail, not to think about traffic and cars, but last thing a parent's thinking about is a bike's going to come flying by. So please be courteous, slow down, be courteous to the people there that are on the rail trail with you, and again, we'll get through this. And there will be 5 food vendors in total in the next couple of weeks. That will be throughout the whole rail trail. I also want to thank CDTA. It's their 50th anniversary. Sorry, Carm, I didn't get on the bus, and I did not get on the Zoom meeting at 10 o'clock. I didn't have time. I was getting briefed on a variety of other stuff. But to CDTA, and a great job that men and women are doing by being out there every day on these buses through this whole thing and keeping the bus routes going and not charging people. Thank you to CDTA and their board, and to Carm, and to the drivers that rolled up their sleeves and literally kept everyone moving, so the people that were essential and had to go to work could get to work. Because yes, I want to remind everyone, not everyone has a car or transportation. No one wants to take Lyft, so it was essential that these buses stayed up through this whole thing. So thank you to the men and women, to the mechanics, to the maintenance, to the cleaners. Thank you to the support staff, to everyone that did their job to keep these buses going and opened so people could continue to come to work that had to be there. I also want to remind everyone about mental health. It's available 7 days a week from 8 a.m. to 5 p.m. Please call. No issues too small to address. And then it could be the slightest thing, and don't feel funny calling. 518-269-6634. Our 24-hour sexual assault hotline. Karen Ziegler and her team do a phenomenal job. So 518-447-7716. And then please, our 211 in our New York State hotline number, as always, call if you have any issues. And that's all we have.